I chose public health mainly because
I chose public health because
my reason for choosing public health was really deeply rooted in my personal experiences.
Many things led me to public health.
Having worked as a physician in a low and middle income country, participating in work in public health allowed me to see that we can treat people or we can address the needs of the people, not just one patient at a time, but as a community as a whole. And that for me was very valuable because working in public health allowed me to integrate environmental engineering, medicine, and public health and see it in a more impactful way.
I remember my family, we moved from Detroit to a suburban area outside of the city. And while I was young at the time, I really couldn't ignore the stark differences in racial demographics, but also urban development. And it really sparked a curiosity, didn't know what it looked like and meant at the time and how to really conceptualize that. Now, understanding that move that I had when I was younger from those two disparate communities, just 30 miles apart, but had a 10-year difference in life expectancy. That stark difference was something that propelled me into the field.
I graduated the year that COVID-19 pandemic hit. So who were the frontline workers during the pandemic? It was people like my parents. It was people like those in my Cuban community, immigrant community, Latina community that were still pushed to or had to go to work and expose themselves to COVID-19. And I had already seen people's social and behavioral risk factors for certain chronic diseases that were then just made worse during the COVID-19 pandemic in my own family and in my community. And that's why I came back to graduate school to get my master's in public health, because I feel like I can hopefully be a mouthpiece for my community.
I have been doing HIV projects for almost 10 years, and my work has always been community-based. Just seeing that human side is so important in terms of designing projects that are actually going to benefit the populations we're trying to serve. Public health isn't just about health outcomes, it's about analyzing our society and the environment that we are a part of and seeing how that has an impact on our health.
it's one of the fields that I feel like can alleviate human suffering, which is something that I'm passionate about.
What's really important about public health is it's really the bedrock of everything, and it really has components in almost everything here. So if we think of all the schools at Yale, public health has a component within each and every school.